This video will be a really exciting video because I'm going to tell you two really interesting stories about pain, true stories that'll probably blow your mind. And it definitely did for me. And it kind of changed my perspective about pain and really helped me to manage my own pain. Hopefully yours too, right? So I titled the video, "The Brain Trumps Medications for Pain." In other words, medications are not as strong as the brain for how we ultimately feel pain. In other words, medications are not as strong, and basically when it comes to pain, it's the brain that's going to ultimately win out. And our psychology, our moods, our thinking, our perceptions about pain is going to be stronger than medications. And if you are someone who suffers from chronic pain, no matter what kind of condition, I'm willing to bet that you have tried medications for pain management. Probably likely the first thing that you've probably tried, at least here in America, which is what doctors commonly prescribe for pain, especially chronic pain. And when I say chronic pain, it's defined as pain that has lasted longer than 3 months. Maybe providers have referred you to also alternative medicine, to things like chiropractor, massage, but overall medications have probably been a huge part of your pain management, I'm willing to bet. And unfortunately, it doesn't work for the very long term, and it doesn't help for the very long term, and your pain probably comes back due to things like drug tolerance for pain medications. They probably stopped working for you over the long term, leading you to need stronger and stronger doses and more of it because you've built a tolerance for these medications and your pain kind of breaks through. For some, it may mean you may need like really high doses. And with that, unfortunately, can come with side effects. A common one is constipation, and that can make you miserable. I've been there before. It's horrible. Every waking day, I'm like just not looking forward to that constipation and just trying to get over it. And so is that like worth it? If you think about it, ultimately, that was one reason why I seeked out alternative ways to manage my pain instead of relying so much on medications. And besides that, you probably feel like very different, right? You're not sober and you're not yourself. You may be kind of doped up and like really, maybe even like sedentary, and you can't live your life normally. You can't even like feel confident like driving and socializing, just living your life because you're just under the effects of the medications, unfortunately, as a side effect, while it's there to manage your pain. And another reason for making this video, unfortunately, here in America and probably becoming more commonplace worldwide, is many more people are becoming addicted to these pain medications, such as opioids. And what's kind of scary for me is they've become very strong, and it's become very easy to overdose on it. So in 1995, the British Medical Journal, they reported a 29-year-old construction worker who suffered a serious accident. They they jumped onto like a plank and they landed on a nail that pierced right through their boot, clear to the other side so they can see it like on the top, like a nail sticking through their boot. You could imagine, or you'd probably be screaming in pain or just dying of pain, right? So they brought this person to the emergency room and they gave the strongest of medications, like opioids. I think it was like fentanyl. And guess what? It didn't touch the pain. I mean, this poor patient probably looked down on their boot and they saw the nail, right? It's like, ouch, I'm in pain, do something about this. Despite them being like sedated, being on some of this strong opioids and stuff. So after a while, the medical team, they worked really meticulously and carefully to remove the boot away from the foot of this patient to look at the extent of the damage that the nail did to like their toes, basically. And guess what? The nail, after removing the boot, went right in between the toes, missing any skin, any tissue, so it did not pierce any part of the body whatsoever. It only looked like it because they were wearing a boot, so they couldn't see their toes. Okay, so what does this tell you? I'm going to give you a moment to think about this, right? The patient suffered no physical injury. No body tissues were damaged, as evidenced by the nail, right? Not piercing any of the skin. But in this man's perception, as will probably be yours, they really thought they were injured and they were really experiencing pain. I want to point this out because even the strongest of medications to help control pain, which typically work, like these sedatives and stuff, they didn't even touch the pain for this patient. So this story, what does it really highlight is that medications are not as strong as the pain when it comes to the brain and our perception and our psychology and our thinking. if that story didn't blow your mind, here's a second one that kind of tags off of that, very similar, to reinforce this point. And this is not this like one single case, like this one person. Because in the second research study, they looked at a lot of participants and then they took the average and they still found the same results. Study participants signed up for a study and they knew they were going to be exposed to pain, and it was a study about pain and things like that. So what they did was they did two things to these subjects. First, they created like an elicited pain in these patients using heat to create a pain response. And they kind of targeted it to be around on a scale of like 66 out of 100. So on average, when exposed to heat, and they were exposed to heat this entire time during the study, they were all experiencing around a 66 with just the heat only. In the next stage of the research, they hooked them up to an IV and they actually started them on some really strong opioids to help them manage their pain, kind of like the first story. I think it was like fentanyl as well. But they didn't tell the subject that they actually started it. The subjects only thought that they were still being exposed to heat and they just had an IV hooked up and nothing was really started yet. And so they asked the study participants, hey, by the way, what's your pain at right now? I just want to check in. And patients reported actually only a very small decrease in their pain, despite them having time to receive these strong opioids. And they reported the pain was right now about a 55 out of 100. So, okay, the medications are helping the patient, like theoretically, they're helping the patient, and the patients recorded a small decrease in pain. Now get this, the patients didn't know that they were getting pain in their system. So it seemed like this pain medication didn't help much, like it's useless. The third stage of this study, they told the patients, okay, now I want to start you on something for pain, when behind the scenes, they already started it. And then they asked the patient, okay, you're getting this pain medication now at this third stage in time. By the way, the patients don't know that they're in this different stages. They're just being asked this throughout the study. We're just kind of seeing it in terms of stages, in terms of the interventions that they did. And they asked the patient now, okay, what's your pain at now? Oh, wow. Patients now reported a decrease from 55 all the way down to 39. That's probably because the patients were being told that they're receiving pain medications. And then in the fourth stage, they didn't stop there. The fourth stage of the research, the researchers basically told the patients that they're going to stop the pain medications, when in reality, they lied. And they continued the medication, and they asked the patients again, what's your pain at now that I stopped the pain medication, when they didn't? And they all reported a drastic increase in their pain, all the way up to like a 64 out of 100. And if you remember in the beginning of the research, the baseline when we first started presenting heat, it was a 66. So despite the patient still being in reality on the same medication, they didn't stop it. Patients reported a 64 out of 100, almost up to that 66. So basically, the medication isn't touching the pain because the patient thinks that it's stopped, when in reality, they're still getting it. So this story, what does it tell you? Similar to the first one, is that medications are not as strong as the brain when it comes to our perception, us feeling pain, at least us thinking that we're in pain. So if medications, even the ones that are so strong, like stuff like fentanyl, like that stuff scares me these days, stuff that's on the street, it takes really little, like there's a billboard in my county where they show a penny and how much it takes for someone to easily overdose. And it's like small smecks, not even the size of a penny, for what it takes to kill you. So this stuff is strong. Like it can literally kill you. Like some of this stuff is used for like animal tranquilizers and sedatives, and people are using it for pain medication and management, and it's not even working over the long term. Then that's probably not the way. So if you think about it, they're being over reliant on medications when they're not really thinking about and addressing the psychological perspective in the thinking part, our brain. Okay, so I want to leave you guys with something here, right? Not just a story and like you feel like there's hopeless, right? So how do we manage our pain knowing this? Because our pain is very real. Your pain is very real. I'm not saying it's made up or anything or that you're crazy. I believe that you're in pain. You're actually feeling like you're experiencing pain because your brain is telling you that you're experiencing pain. So think back on the stories with the boot or the being lied about pain being stopped for the heat test in that study. What's likely to be the case if you're suffering from chronic pain is that you're likely perceiving your pain to be very, very extreme, when in reality, your body has likely healed. and you're no longer injured because you're not like having to call 911 and you're in like a life or death. Like you need to go get an emergency surgery. Like you're not dying. You're probably okay because it's probably been days, weeks, months, even years. And you're still okay in terms of like your overall health. So that really tells you about the power of your psychology and your belief and how you think your pain is and how extreme and overreactive you may be when it may just be a nail right in between your toes kind of situation. And you may be kind of left with heightened awareness. So yeah, I'm just a random person on the internet. I'm an occupational therapist. I've looked into this stuff. It's a big part of what I do, and I've experienced chronic pain myself, right? So take that for what it is. But a lot of people have individual cases, and your pain is personalized to you. You may have fibromyalgia, irritable bowel syndrome, low back pain, whatever it may be. It's probably been a long time, and doctors may even told you that you're healed and that your pain should be improving. And if you think back and reflect on your life, you may have been perceiving your pain to be just way too high when in reality, nothing is wrong with you technically. And I get it. I've been there. I've been told I have degenerative disc disease and 2 herniated discs. Ouch, right? Hearing that probably hurts you, right? But after years of suffering from pain, trying medications, chiropractor, or exercising therapy, using therapy on myself, I was still in pain, believe it or not. And it wasn't until I really started to looking at the psychological component and the social component of pain in my pain story that I really learned a lot about how I may have been over heightened when it comes to pain and thinking about it. My body is likely to be okay, even though I have on paper this scary term about degenerative disc or slipped. It's okay. And I don't need surgery. I don't need to be so cautious about my body and moving. I can go back to work. I can go and live my life. I can go and lift my kid up. I can drive and do all these things. And so can you. As you change your thinking about pain, the frequency of pain, the intensity of pain, I'm willing to bet that it'll slowly go down over time. And that's really incredible and really cool. And I can say that with a pretty high confidence because it happened to me and it's happened to a lot of people, and it can and it will happen to you. Once you get into this mindset and this understanding and get this kind of education and learn about more about the pain and how it works and how it's not just a physical thing. And if you think about it, it makes sense. Like our body is spiritual, mental, psychological. It's connected to our body and our brain and how we feel and think. We have emotions every single day. And if our emotions are so negative around pain, think about it. Will pain win out? It probably will. And it has. So don't let that take over your life. And hopefully this has given you some insights, these 2 stories and how powerful they are in my story as well. Personally, I would normally say like, take it easy, but go out and do something and don't be so fearful because it's likely to be okay. You're probably not going to break anything when it comes to chronic pain anyways.